Neurosurgeons are doctors who are trained specifically to deal with diseases that affect the human brain and spine. Not to be confused with neurologists. Both of us deal with conditions affecting the brain and spine. But the only difference is that neurosurgeons actually perform surgeries to treat conditions that affect the brain and spine. So for example, if you have a brain tumor, then a neurosurgeon comes in. Depending on where the tumor is, size of the tumor, then we will probably end up doing brain surgery to remove the tumor. Similarly goes for cases of spine tumors. So if you have a spine tumor, then a neurosurgeon comes in and removes the spinal cord tumor. Apart from tumors, neurosurgeons in Malaysia are trained to also deal with diseases affecting the blood vessels of the brain. For example, certain conditions like brain aneurysms or abnormal vascular formations in the brain. We also treat conditions such as brain infection, traumatic brain injury where you have a blood clot in the brain that requires us to remove it, and conditions which cause brain swelling like hydrocephalus. So neurosurgeons are a group of doctors who are specifically trained to deal with diseases on the brain, specifically to operate and to treat those conditions. Neurosurgeons in Malaysia also treat spine conditions, particularly conditions which are known as degenerative spine disease, or things like disc prolapse, slip discs affecting your cervical spine or your lumbar spine. These conditions are also treated by neurosurgeons. Neurosurgeons in Malaysia are trained to treat both adult and pediatric or children's conditions. So I also operate on children with brain tumors or brain conditions that require surgery.